showed the hypertrophy of the papillomas that can take place in pregnancy. So typically, what you'll find with papillomatose is that they're symmetrical and they're usually very small, and they'll look identical. And you'll be able to trace the whole projection to the base of the vulva. It can be confused for HSIL. So here on the right, this is an example of HSIL, but you can see, number one, the projections are not symmetric. Number two, they have a different color than the mucosa, which the papillomatose, it's going to have the same tissue color.
Je vais dire, là à la droite, vous voyez que c'est une lésion d'agrate sur la vulve et il y a quelque chose qui vous dit que ce n'est pas une papillomatose. Numéro 1, que les projections sont pas uniformes comme la papillomatose. Et deuxièmement, qu'il y a un changement de couleur, que la papillomatose a la même couleur que les tissus normaux.
And then another finding is that when you've laid down the vinegar, and this can be confusing, you can still see acidophil changes, but they're not necessarily going to be L-sil or H-sil. Possible causes for that can be inflammation, fungal infections, or trauma to the tissue. So it can be a little bit difficult to do vulvar colposcopy and identify abnormalities. But the big thing is that the more that you can do it, that you get to do it, you'll be able to have more experience. And then also you can always bring in colleagues of yours who maybe have more experience to help support you. And you can always take a picture if you're never sure. And discuss it with colleagues.
Alors, il y a des opportunités, des conditions qui sont un peu confondantes. Alors, si vous êtes pas tout à fait sûr, vous pouvez avoir des collègues qui peuvent avoir un autre aspect avec des autres lieux sur l'endroit où vous pouvez prendre une photo et partager avec les collègues. Je ne suis pas tout à fait sûr. Qu'est-ce que vous pensez de ça?
Another finding that can be confusing is sebaceous hyperplasia. Typically, when you look, it'll look yellow or maybe a little bit white, but you'll see that it's usually kind of uniform in its appearance, and they can get bigger. Depending on a woman's hormone balance, but this is a benign finding. Yeah. It's not too common. All right, now we're going to talk about some non-neoplastic benign conditions. So the interesting thing about these conditions that are listed is a lot of them might present with the same initial symptom or concern. The patient will say that they're itchy.
C'est les conditions qui présentent à peu près les mêmes. Les malades vous disent que ça pique.
So contact dermatitis, this is typically a reaction to something topical. And usually you'll see the skin changes in the shape of whatever has caused the reaction. And it can happen in the vulva. Of course, this is an example of someone had a watch on their wrist. And what happens is the inflammation and as well as the patient scratching over time leads to that thickening and darkened area. And it's typically, like I said, in the shape of whatever triggered the reaction. And so sometimes you might see for patients, especially if you see some changes like this in the vulva and it can look similar to this, it might be because of their sanitary products or undergarments.
Avec le dermatite au contact, c'est tout d'abord c'est dans la forme de ce qui cause le problème. Avec l'arrêt de la vulve, ça peut être une réaction avec un certain produit qu'on peut utiliser dans la région ou des produits sanitaires.
A condition that's similar but different is eczema.
C'est une condition qui est comme le contact mais différent, c'est l'eczéma.
So eczema is typically a chronic inflammatory condition that starts in childhood. It's not typically caused by something topical randomly later in life.
Normalement, c'est quelque chose qui commence avec les enfants, qui progresse, et normalement, ça commence pas dans les études, ça a commencé comme enfant.
And it can appear, you see the rash here, it can appear similarly to that even on the vulva, or you may also see peeling skin. And then this is an example, the next photo, of significant eczema of the vulva. And you can see that the area is irritated, it's red, and swollen. And typically with eczema, it's a condition where the skin is exquisitely dry, the tissue is exquisitely dry. And then you end up with an altered immune response to that condition. And so itching and scratching are common symptoms that people exhibit. And it can be worsened by soaps, perfumes, heat, humidity, etc. And in terms of the treatment, the big thing is that you want to prevent that dry skin. And you also want to remove anything that's going to make it worse. So typically what I'll tell patients, especially if it's not as severe as, like this is a pretty severe condition of the vulvar eczema. If it's not that severe, you can start with just having lifestyle changes for the patient. So you can give them recommendations of how to manage their skin, what different lotions or Vaseline to apply, and how to do that to keep moisture in. If it's not responsive to those lifestyle changes, or if it's severe, you can initiate steroids, topical steroids. And for some patients, typically they'll respond to the steroids pretty quickly, and then they don't necessarily need the steroids for life, but they might need some treatments intermittently later on.
Seulement un peu de sommaire que le premier changement, c'est éliminer les facteurs et un traitement des symptômes avec éviter les choses qui sont des irritants. Si ça ne marche pas tout à fait, on peut commencer avec les stéroïdes topiques, et ça peut être seulement pour un bout de temps, et on ne doit pas les utiliser. C'est pas nécessaire de les utiliser toute la vie. On peut les avoir de temps en temps.
A condition that sometimes is confused with eczema is psoriasis. And this can also show up on the vulva. Typically with psoriasis, you'll have more discrete areas of the rash. They'll look like papules, and they might be blue or purple in their coloration. And they also typically will scale, but the scaling is usually confined to the papule. And sorry, some of the text got cut off. But what you can also see is hypertrophy over time, especially again, if the patient has been scratching the rash. The thing about psoriasis is if you're not sure if what you're seeing in the vulva is potentially psoriasis, typically patients will have the rash elsewhere on their body. So you might want to consider doing an exam of their extremities, usually the arms, the legs, behind the knees. Some people also have it, in front of the knees, and some people also have it on their back.
Là, c'est pas seulement sur la vulve. Les gens généralement qui ont de la cirrhosis vont l'avoir d'autres parties des corps, souvent sur les bras, sur les coudes et sur les genoux, et parfois aussi sur le col, mais ça peut être dans différentes parties du corps.
All right. Another condition is lichen simplex chronicus or lichen simplex chronique. And this is a result of a cycle of the patient is itchy, so they start scratching, and then they're itchy, so they keep scratching, and it goes on and on.
C'est souvent un résultat d'un cycle qui dit gratte, pique. C'était moi juste more common word.
Yeah. Typically, the patients will have tried so many different things and nothing will stop that cycle for them. Treatment for this condition is you really want to stop that cycle. And so different strategies are used to try and support that. So the person can consider just a bath in plain water, or that you've ruled out any underlying infections, especially yeast. And then sometimes, and so,
Oui, ça c'est. I'm just going to do the non-treatment part.
Yeah.
C'est dans le cas où il n'y a pas de traitement, vous pouvez voir les résultats. C'est pas seulement la peau qui est si fine,